All right, on this episode of the Mad Medics Guides to Medicines, without a doubt, this is the stuff that makes you want to puke. That's right, we're talking about Ipecac. And the 100% grade A barf sauce, okay? You want somebody to throw up, this is the stuff to do it. And, again, which is why we're going to talk about why we don't use it anymore in the pre-hospital setting. But again, there are still some places that use it. You got to know about it. Matter of fact, some people take it willingly. I don't know why. Again, it's just the what it makes you do is just absolutely horrific. So it's used to induce emesis by irritating the stomach lining and the chemoreceptors. And it is an emetic, okay? It's going to make you throw up, and you're going to... So it kind of acts on the brainstem and the gastric mucosa, and it produces vomiting, okay? Usually I'd say it's around the 20-minute mark. We have them drink it. They're sitting there, they're fine. Next thing you know, yes, sirree, Bob. Nothing but puke, and nothing but the puke. And it lasts for about 20 to 25 minutes once you actually get the sauce on board. All right. So, again, and I've actually had it where people drank like a whole thing of it, and they're like, 30 minutes later, they're still not puking. And so you actually repeat it. So there are a few people that it actually doesn't work on, all right? Now, obviously, if you're inducing vomiting, this should go against every bit of your paramedic training. Because what's our big problem with vomiting? Which is airway, okay? So it can definitely cause problems with the airway, okay? And you need, again, there are some specific instances when you would want to do this, but they're few and very far between. It's done when they've overdosed the conscious alert patient, and we know for a fact they overdosed, and we know that we got to get it out of it before it starts to absorb. Now let's do a little time math here. Somebody's got an empty stomach, and they eat let's say a handful of pills. Those pills usually are made to start dissolving in the stomach and get immediately into the gastrointestinal tract for absorption. That's the way we make these things, okay? So once you do that and it gets into the small intestine, remember that it's built to go faster into those spots, all right? It's going to get there quicker. Now, let's take some other factors involved. It usually takes an ambulance from the time that they're called somewhere around 10 to 15 minutes to initiate patient contact, another 10 minutes to do your assessment. A lot of times this stuff is already past the point where Ipecac is going to work, all right? So if the patient just downs a bottle right in front of you, I can see where you could make an argument as to, let's get them to puke it up, okay? So again, it can cause seizures, it can cause CNS depression, bradycardia because of the retching, and it can cause blood pressure to drop. It does cause diarrhea and a prolonged vomiting. Yes, that's why we had them drink it. If the poisoning involves any type of strong acid or alkali, any type of petroleum, no, we don't want. It's better to leave it where it's at, actually. So don't make them throw it up because you're just going to eat and destroy the esophagus even further. Antiemetic poisons, especially the phenothiazine group, these guys, we don't want to use those. And then any patient who cannot protect their own airway, okay? By the way, your phenothiazines is like your phenogrin, that type composines, that you don't want to use it with and along with them. And then any patient that can't protect their own airway. Again, if they're going to go unconscious on you, probably a bad idea to do this, okay? If they got any type of cardiac disease, guys, puking is really hard on the cardiovascular system. So, again, when you got the patient who is even just normal nausea and vomiting, it's probably a good idea to kill that. Again, a good dose of Zofran or phenogrin to help relax that so that they don't puke their guts up and cause a dysrhythmia. Good news is activated charcoal, it absolutely absorbs Ipecac. So if you are giving those drugs in combination, you let them have the Ipecac, they'll throw it up, and then after that 30 to 40 minute period, then you have them drink the activated charcoal. I would say your activated charcoal is a better idea anyway, so that it starts absorbing the poisons that might be down there. Ipecac is cardiotoxic, so it will cause damage to the heart. Okay, don't confuse syrup Ipecac with Ipecac fluid. Ipecac fluid is 14 times concentrated, and it's fatal when given at the same volume you give the Ipecac syrup. Okay, so make sure that it is actually in the formulary. And if water is not tolerated by the patient, you can try carbonated beverage juices. It just delays the onset of action just a little bit. Anything except milk. We don't give it with milk because, again, that inactivates it. Probably a bad idea. All right, Emesis can precipitate convulsions, and retching can cause increased vagal tone, which will then cause them to have bradycardia, which, again, cardiac effects. We usually comes in a 30 milliliter vial and a 50 milliliter vial as the preparations. We usually give 30 milliliters, then we give them 16 ounces of water. And if they're pediatrics, we give them half that dose. If they're less than 1 year of age, it's just 10 milliliters. And then we follow it with some water and let them puke. Folks, I would say I don't think I've ever given it to a ped. Even like maybe once they were like 15, 16 years old, I think maybe a couple times I've done that, but most of the time have not done that. All right, again, it is a PO drug. We give it by mouth, and yeah, you can give it pregnancy, but again, you're causing puking that can cause some serious effects upon the fetus. I'd be careful with not doing that. The last thing to say about this, and that most of these drugs, the Ipecac that I've been talking about, is not it's out of favor. Again, the charcoal works just as good. Again, most of the time our lavage is going to be too little. If we have them throw it up, it's going to be too little, too late, and the risk of aspiration far outweighs the good of the Ipecac. Unless there is a bona fide reason to do it, and like literally they down the pills right in front of you, that might be the only reason to even consider doing this, okay? So, again, it's kind of fallen out of favor, but I wanted you guys to know what Ipecac was. And, again, kind of an easy drug to go off of. I'll see you guys on the next one.